Hello and welcome to the TiPH podcast, where we explore the world of public health, interviewing registrars, academics and leaders in the profession. My name is Josh Howkins and I'm a specialty registrar in public health in the UK. The aim of this podcast is to offer a wide view of what it means to work in the field, while hopefully providing some inspiration to those who would like to train in public health. Today, I'm honestly really grateful to be joined by Professor Martin McKee, CBE. Martin, thank you for joining us.
Thank you very much, and it's nice to be with you.
Many listeners will already know Martin, President of the British Medical Association, Professor of European Public Health at the London School of Hygiene and Tropical Medicine, and active advocate for the health of the public with a broad reach through social media, scientific articles and podcasts like this one. Martin, if we can start fairly near the beginning, if okay, you trained medically in internal medicine and public health. Looking back, it seems quite quickly you took on a cross-border, big picture approach. How do you remember this development and those early years? Was this big picture approach always an aim of yours?
So when I was at school, I was interested in the world around us. I was reading about the politics, the agenda around decolonization, the situation in Europe during the Cold War. As a teenager, I was sort of broadly interested in what was going on in the world. And of course, my teenage years were very much dominated by the East-West divide in Europe and by events in the Middle East with the wars that were taking place there. So I watched that with great interest. I traveled within Europe on Interrail right at the very beginning. I was one of the group of those early pioneers traveling through Central Europe, through Hungary, down through Yugoslavia into Greece, and then later into Scandinavia. So I always had those broad interests. But I went to medical school, trained in medicine. I qualified at a rather young age. I was 22 when I qualified. And I moved almost sort of automatically into internal medicine and then into an academic medicine job. But the challenge was that I was working in the laboratory, as one did in academic medicine in those days, but at the same time doing outpatient clinics where I was seeing the social determinants of health writ large. I had patients with scurvy, with beriberi. I was understanding and experiencing the deprivation that led them to be in the hospital. I also came from a medical background. My parents were general practitioners. In fact, I've written about this in the BMJ and referring to the movie Belfast, which in a way was a microcosm of where my parents worked in Northern Ireland, and that clearly influenced my experience. So it became clear that I needed to do something different. I didn't want to spend the rest of my life working in laboratory. I moved into public health, and I always had this interest, particularly in Europe. In fact, if I may digress slightly, when I was applying for medical school, I was interviewed at a medical school in England, and I'd flown over to be interviewed, and they asked me an outrageous question now: did I see myself as British or Irish? And I replied European. So I clearly had that perspective at the time. But then I was appointed to a senior lecturer post at the London School with responsibility for developing the school's work within Europe. And I was appointed in October in 1989. And of course, on the 9th of November in 1989, the wall fell down in Berlin. And suddenly the canvas in which I would be painting my life's work suddenly expanded to a much greater extent than I could have expected. And really, the rest is history.
Something we talk about a bit on this podcast is finding your voice. And through that journey, that development you're describing, where did you start to find your voice within that? Or was that there from the start?
I'm not sure that it was, but when I was working in internal medicine, particularly because I was sort of on a conveyor belt, which took me down the academic medicine line, clearly the idea of publishing papers was there from a very early start. And my earliest papers are in some clinical and in areas like autoantibodies and peptide biochemistry. So the idea that you would write papers for an audience, and I've got a very early paper in the BMJ, for example, it was already there, so that when I came to do public health and do the master's, it was sort of a natural progression to make sure that when I did work, I would write it up for publication. Now, then as I moved on, I was getting into areas of work which were inevitably somewhat political. And I think a characteristic of my work has been that it has been on the interface between health and politics. I'm sure we'll talk about this later. So therefore, there was a need to communicate that to a wider audience beyond those people who might read the BMJ or the Lancet. And so I certainly got pulled into work dealing with politicians, with policymakers, where I would be engaging on some of the issues. And that led naturally to writing for other sources. And then when social media came along, I was a relatively early convert to Twitter, and using that and a range of other media outlets, because I think it's incredibly important that we do work. If we're doing publicly funded work, we have a responsibility to make sure that it is actually put into the public domain where it can be used. And I've spent a lot of my time working with other people to try and make sure that something happens to what we do.
Very important. And I think you're right. We will, if it's okay, come back to politics. If first of all, I just want to know a little bit more about your drivers, if that's okay. So I think it's very fair to call you an advocate. You mentioned sort of social media, publishing articles to be read. Are you an advocate for, what would you say, social justice? What drives you?
Well, I have to say that there is an element of writing is a form of therapy for me. Other people might shout at the television, but I think what I find, and I'm very grateful to my colleagues, in particular, Juliet Dobson and Kelly Brandle at the BMJ, who, whenever I'm particularly irritated about something, will allow me 800 words to sound off about it. And sometimes that has some value. Sometimes it actually does lead to something. But beyond that, yes, I think I am powerfully shaped by what I have seen during my life. And some of this does go back to my upbringing in Belfast. And it comes back to being brought up in a divided society, a society where, in my interpretation of it, people were being divided to, in a way, fragment and disrupt the power that the working class might have had to challenge the established system. I think it benefited both sides. Now, I know that's a perhaps unconventional interpretation, but coming from a third generation medical family and a very comfortable middle class existence, that was the view that I had. But of course, I was shaped as a teenager by my readings of what was happening in the rest of the world. And in particular, some of the things that were happening in Africa and Latin America at that time. So I think that shaped me. Also, the experiences that I've seen as I've in the work as I've traveled across the world, I've had a number of very formative experiences. I think I have to be careful because some of them actually are still quite emotional even now. I would single out one that has had a huge impact on my life. And it was working with WHO in Sarajevo during the siege when I was flying in with the Ukrainian Air Force crossing the front line. But then several weeks after that, I'm going to be very clear here, I'm not making a direct comparison because I know that it gets very controversial. But several weeks after that, being in Auschwitz, coming from a city that was under siege where people were being bombed, to the horrors of what had happened in the 20th century. It was what had happened during the 20th century was a very, very powerful influence. Similarly, having been in parts of the former Soviet Union during those early days of the post-transition, being in Romania in the very early days after the death of Ceausescu. Some of these were places I'd traveled before the collapse of the Soviet Union. I'd traveled quite extensively on Interrail and in other ways. I had unusually been in Albania in the mid-1980s. Very few people had been there. So I'd seen all of these, and these very powerfully shaped my view of humanity and inhumanity. I also work quite a lot in the Middle East, actually, in Israel, Lebanon, and in Palestine. And again, the experiences there. So I think having seen all of these things, they leave an impression on you and they build up. I've written before about some of the comparisons between a particular incident that happened one time when I was in Jerusalem that resonated very strongly because it almost mirrored something that happened while I was in Belfast. So I think these things have shaped me very powerfully in terms of the work I've done. And it is a commitment to social justice. It's a commitment to breaking down barriers. It's a commitment to challenging xenophobia and racism and all that goes with that. I'm sounding terribly pious here. I don't mean it to be, but genuinely, I do believe in these things.
We mentioned Europe earlier, and I suppose we've talked about where you work and think about how you work now and then partnership working, if that's okay. I've heard you talk before and alluded to in this so far, the importance of partnerships, of building and in maintaining them as well. And I just wonder, what advice would you have on achieving good partnerships and working across roles and organizations or borders?
I think a degree of humility is important in the first instance. I've been very fortunate to have worked with a lot of very clever people. The work that I do is perhaps a bit unusual because in academia, we're encouraged to specialize, and my work is anything but specialized. If I'm dealing with some of these really complex problems, like the mortality crisis and the collapse of the Soviet Union, the work that I've done has gone all the way from analyzing the alcohols that people are drinking, autopsy studies looking at the effect that it had on their body, all the way through to the epidemiology and to the political science. And I don't claim to be an expert in all of these areas, but I do work with people who are. And so you have to work in collaborative teams. I also believe very strongly in understanding the country that you're working in. And that means reading the history, understanding the politics. I sometimes joke that some of my colleagues look on countries as being dots on a scatter plot, whereas I've got the atlas and the history book and very light-hearted criticism. But I think it is important to understand where you're working. And then as an extension to that, I think it's very important to work with the people who are affected by your decisions. I've talked in the past, I've in fact drawn a paper that my wife wrote about putting flesh in the bones of epidemiology, understanding that the figures we deal with are real people, which means that the decisions we make or what we recommend need to actually understand the lived reality of people. So you can't do that in isolation. You've got to get out on the ground. You've got to work with a wide range of people, and you've got to listen. It was strange for me to say that because I'm doing a lot of talking on this podcast, but I think it is very important to listen to other people and really listen, because when you listen to people, you understand the nuances. You recognize that so often, particularly when we're talking across countries and across cultures, that we interpret words as we understand them, whereas other people are using words as they understand them. And you need to be always constantly checking that when a word is used, it's not, to quote my favorite philosopher, Lewis Carroll, the situation with Humpty Dumpty saying that words mean what I choose them to mean. We need to really get that shared understanding, and that can be quite a challenge.
Thinking about Europe and again, just sort of partnership working with people in the European Union, that relationship and the policy effects is something that you've written a lot about. What do you think we need to do? We perhaps lost a big partner in many ways when we left the European Union. It made things complicated. What do we need to do to strengthen ties or to improve partnerships and outcomes with European colleagues now?
Well, first of all, I would correct you that you say we. I had the good fortune to be born in the island of Ireland, and I have my Irish passport and my British passport, although it's of increasingly less value anyway. And I work very closely with colleagues in the European Commission. I'm in Brussels frequently. I have very strong links also with WHO Europe, very strong links indeed. So I don't see myself personally as being outside the European Union. And I think that's been quite interesting in that I've been following developments, including, and we will maybe just mention one contemporary development, the Windsor Framework, the attempt to address the Northern Ireland Protocol. I think when you look at that from a continental European perspective, which I tend to do, rather than from a UK-based perspective, you see things in very different ways. And often I think that the whole debate about the European Union, even in those people who are, among many people who are very pro-European, often misinterprets things and actually sees it through a UK, or I would say particularly an English lens. So I think that can be a problem. And I think we do see that very much at the minute. We've got documentation that's coming out about the agreement on the Northern Ireland Protocol that when I read it, I'm clearly reading something very different from the way that it's being interpreted in the British media. but much more in line with the way it's being interpreted in the continental media. So I think that to some extent, some of us are in a fortunate position in that we haven't really left, although obviously de facto we have to some extent. I think it's going to be incredibly important to do everything possible to maintain those links informally. We've lost a lot of the structures and the institutions. I've been managing an Erasmus Plus scheme for the last few years. I've got 3 absolutely brilliant trainees on that scheme who've been spending some time in Brussels. One is currently in Copenhagen as well. And we won't have those opportunities in the future. We don't know what's going to happen about Horizon Europe. The door has been opened by the European Union to start negotiations, but this morning it was reported in the Financial Times that the British Prime Minister, Rishi Sunak, is now expressing doubts about whether he wants to be in it. So I think that we clearly have a lot of problems, but I think if everybody can try and maintain those links as far as they can, despite the barriers that are being put in place by the British government, then at some point, but it may be a long time, then I think we will be in a position to rebuild them. I have to say, my personal view is that we will be back in the European Union. We may have wasted 20 years before that happens, but I have really no doubt that we will be back in, because the current situation just is so laden with contradictions that it's frankly unsustainable in the long run.
Keeping an open mind, maintaining those links informal or otherwise, and just being ready for developments, I suppose.
For me, it's just natural, because that's where my connections are. That's where my closest friends are. My spiritual homes are probably Brussels and Berlin. I identify very much with them. I feel totally at home there. And that's the language that I'm immersed in. So from my point of view, I realize I'm in a very, very unusual position. I live in London, but my frame of reference is entirely European. But that's unusual.
Moving a bit closer to home, you mentioned Rishi Sunak and I suppose ways of working with our own government. You're president of the BMA. It's a historic time. Junior doctors have voted in record numbers to take industrial action, which will take place fairly soon now. How did you feel when the result of the ballot was announced, and were you surprised?
No, I wasn't surprised at all. I have been listening to junior doctors, some of them my own trainees, but also to others, and I have been truly horrified. I worked very long hours. I worked 1 and 2, 1 and 3 rotas. As an SHO, I was a medical registrar for 3 years, working in gastroenterology and nephrology. But it was very different in those days. We were part of teams. We had very supportive consultants. We worked very closely with the nursing teams, the other therapists. And we had just all the little things like somewhere to sleep at night, when we were on call, availability of food. We weren't paying for car parking. We weren't paying back our student loans. And now what I hear is that in the UK, and it is different in other countries, but in the UK, junior doctors are really not being valued. And of course, the pay has fallen well behind, 26% falling behind, as it has for other public sector workers. But it's not just that. I think why we saw 98% of the 75% who voted in the ballot voting for industrial action is simply because they have had enough. And so I wasn't surprised at all. And unfortunately, when you have a government that does not listen, there is no alternative. Now, I've written before with Israeli colleagues, Israel has had a number of doctors' strikes, that strikes by doctors should be a never event for a health system. They should never happen. And when they do happen, it tells you that something has gone seriously wrong with the health system. And I think we know that something has gone very seriously wrong with the NHS. We have had it has been starved of investment, particularly in capital, but also in humans and in people for over a decade now. And we're now essentially reaping what we have sown. So it's not surprising. It's very regrettable. But I stand totally behind the junior doctors who are taking industrial action, because I cannot see any other way in which they will have their voices heard.
What more, you mentioned starved of investment, the people and the capital side, and part of it, of course, of what can be done is the financial, the individual, the pay restoration question. But What more do you think needs to be done? What engagement would you ask of the health secretary or others?
I would go back to some work that we did in the financial crisis, and it's in a rather different area, but we were looking across Europe at the experience of job losses and the impact on mental health. And what we showed was that for populations, if you had governments that put in place what we call active labour market programs, they could break the link between job loss and suicide. But more broadly, what we were really picking up was that the governments that broke that link were the ones that sent out a message to their population that we care about you. We're interested in you. We're supportive. We may be constrained. The global financial situation may be difficult, but we are on your side and we will do something to help you. I was very privileged this week. I was listening to the Icelandic Prime Minister, who really has this very clear message of a government that is interested in her people, that really cares. So I think that's very important. It's very difficult to see how we'll move forward in this. I think we now need in health systems in many countries, and this will be the topic of a ministerial conference that I'm helping to organize for WHO later in 2023, which will be looking at the future of health systems. And we're identifying 3 ways in which we need to restore trust. First, the trust of the public in the solidarity-based health systems, because there is a danger that people will just simply think that that universal healthcare is unaffordable or impossible or something like that. And of course, there are a lot of people who are saying this. They're saying, well, the rich should opt out, which of course would simply leave a poor service for the rest. So we need to work on that because there isn't really an alternative to the welfare states that we have. We look to the United States for what happens if you don't have that. You pay a lot of money and you get terrible outcomes. We need to restore the trust of the health workforce in the health system so they stay. They don't leave early, they don't emigrate, and that is the real challenge. Politicians at the minute are talking a great deal about recruiting more health workers, but it's like trying to fill a bath with the plug removed. The key issue at the minute is retention. The third area where we need to build and restore trust is trust of politicians in the health system, so that they believe that if they do provide more resources, they will be used effectively, that there will be a benefit. And I think we can show that. But it will be a challenge to overcome the skepticism, the mistrust that has become so prevalent, particularly since the pandemic.
You've mentioned previously that I've heard you say that medicine picks up some of the failings of government policies, which is quite resonant, really. It feels to me, working in public health, and maybe it can feel like we have very few levers to act as individuals. Do you think the role of healthcare professionals, particularly in public health, is it changing as a result of current events?
I'm not sure if it is changing fast enough. I do believe that we have a situation in the UK and in some other countries where different people are picking up the pieces of failing elsewhere. It's not just that the NHS in the UK is picking up the pieces of failures in other systems. The criminal justice system is picking up the pieces of the failures of the NHS in the area of mental health, for example. Our prisons are full of people who should not be there and who should be being cared for by the health service. But I think that we do need to start saying much more loudly that health professionals are working flat out. They're leaving the service. They're getting burnout. They're getting moral injury and all the rest. And a lot of that is because our politicians are essentially allowing the social safety nets to be ripped open. They're underinvesting in the necessary infrastructure for the topic that, in fact, I've been talking about over the last few days in Copenhagen at the WHO meeting, which is the well-being economy. How do we create a virtuous cycle in which we can see better health feeding into economic growth, which we know can happen? Healthier people are more productive. They stay in the labour force. And obviously, healthier people need less healthcare. So we need to get back to that virtuous circle and build a new country. Not just, and it's not just about getting other sectors to do things for the health system. in the European Observatory, where I'm research director, we've just published a policy brief, which is about not just health in all policies, but health for all policies, the co-benefits, recognizing that other sectors can help us in health by reducing the burden of disease, but that we can help other sectors. We can help by having healthier children and adolescents who will perform better at school, who will go on to contribute to economic growth. We can contribute to economic growth and to the life sciences, and in so many areas. So there are lots of examples where we can work together. So I think we in the health professions need to articulate those arguments much better than we have done so.
We're talking about the political aspect of public health, trying to focus down on how we as practitioners can engage in this sphere, and how maybe the role of a practitioner in public health, how we might hold government to account. I was reading the textbook, Mastering Public Health, which is sort of the reference book for any public health trainee going for their exams. You wrote the foreword to the most recent version of that. You lament sort of fragmentation of healthcare systems, but you also talk about the detrimental effects of political failings and austerity on the public. You're trying to dial down on us as practitioners and trainees and holding government to account, or going about this space. What lessons have you learned that would be good to pass on to trainees, or how should trainees develop their skills at this interface of public health and politics?
I've often said that one of the core responsibilities of public health is to make the invisible visible. And by invisible, I'm thinking of the invisible people, the people who come to clean our offices in 5 or 6 a.m. in the morning and then are gone by the time we get to work. The people who are working behind the scenes, in the kitchens, in the sweatshops, in the factories that allow us to live the lives we lead. So part of it is making them visible, but also a crucial part of our work, because of our skills in epidemiology, are to make visible the connections between the structures in society, the causes of the causes, the commercial determinants of health, the political determinants of health, and the diseases in which they cause. And so we see this very clearly, I think, with the work that has been done on climate change, where people have linked the El Nino effect with landslides and flooding and things like that. Very complex chains of causality that go beyond the basic epidemiological methods. The work that we did showing the link between the financial crisis and health, for example. So I think making the invisible visible is really important. Invisible people, invisible mechanisms, invisible outcomes. Then, of course, it's not just enough to publish this. We do need to do something with it. And there, I think it's very important to look at how we communicate our messages. One of the things I'm doing as the president of the BMA, you are expected to do a project. And what I'm going to be doing is looking at the people who I think are the real heroes in this, the people from, because it is the BMA, I'm looking at the medics, but I'm looking at those people who have been able to communicate health messages to a much broader audience. And there's a whole range of them, through television, through poetry, through drama, through interviews, through podcasts like this, for example. I have to say, I'm not entirely limiting myself to real doctors. I'm delighted that I'm going to have Steve McGann, Dr. Turner from Call the Midwife, because I think that is a brilliant program in exposing the gritty reality of health and looking at the social determinants. I think it does it very well. So we need to be more imaginative in how we communicate. I think there is a problem in holding the UK government to account. And that's because I'm not sure anybody can really do it at the minute. We have a parliamentary system that fails to do that. We have a select committee mechanism which does what it can do, but it has limited powers. We have a second chamber, which is, because it is not elected, does not have the same degree of legitimacy that an elected house would. We have a court system, the Supreme Court in particular, which I think under Baroness Hale was willing to challenge the executive, but under Lord Reid is, I think at the minute, less willing to do so. And there's certainly a pushback against what are called activist judges. So I think if we look at it from a constitutional perspective, something we argued actually before the COVID pandemic, I think there is a crisis of governance in the UK. I think there are significant problems of accountability, not just of the executive, but also I think of many of our institutions. And some people may have read the article I wrote a while back arguing that the General Medical Council had a crisis of accountability as well, accountable in theory to the Privy Council, an entity that has its origins in the Anglo-Saxon kingdoms. So I think we need to we probably could modernize that a little bit, but that doesn't mean that we can't do anything. We need to develop our narratives, and I think developing a health-related narrative is incredibly important, and then finding ways to disseminate it and to challenge the anti-health narrative. Often in many areas of political science, people talk about the Overton window, what is possible and what is not possible, and the window shifts over time. So if I look back to the 1950s, when Conservative governments were in power, like Harold Macmillan, who boasted that one of the greatest achievements of his government was the building of hundreds of thousands of council houses. A Conservative, but someone who was shaped by his experiences in the trenches with his soldiers in the First World War, that generation that came through the war and had that sense of solidarity, and the way in which our politics has moved much more to an individualistic, sort of almost anti-solidarity model here. We need to challenge that narrative and perhaps get back to where we were in the past.
Talking about challenge and about communication being shaped by your experiences, I think we're touching on leadership attributes and values. I think, what lessons have you learned on public health leadership?
Well, I have written about this, and first of all, I'm not making any claim that anybody would ever want to follow me. I think that would be both arrogant and probably unrealistic, unless they were doing so out of a sense of curiosity. But I think it's important to choose your moments. I mean, I read history a lot because you need to understand the countries one works in. I think to draw on Field Marshal Montgomery, for example, he would have argued that you never fight a battle that you're not going to win, although he didn't quite get it right at Arnhem, but leaving that aside, I think you choose your battles and you work out where you do have some hope, some prospect. It may be a long-term prospect, and it may be about trying to change the narrative so that something will happen eventually. I think it is really important to go back to what I was saying earlier about listening. You need to listen to people who take a different view, because sometimes you will actually be agreeing on the same things. And I find that when I'm talking to people in business, for example, which I do, and I find that often there are fundamental differences that are the paradigms or whatever, but they can be addressed and you can find common ground. Not always, but sometimes you can. So I think it is important to understand where people are coming from, and we shouldn't just simply assume that by talking loudly and slowly that they will understand that what we're saying. We may have those very fundamental differences, but they can be bridged. So I think also understanding where they come from is hugely important if you're talking to somebody from a particular political party, and most of my work is outside the UK, or in a particular country, or from a particular sector, that you actually understand where they're coming from. And I had this experience 2 days ago when I was facilitating a ministerial lunch in WHO, where there were ministers, many of whom I've known for some time, or I know they're senior advisors, and it is the ability to, for example, whenever the issue of elections came up in the country was Armenia, in fact, I was able to turn to somebody from the Czech Republic because I knew they've just had one, and we could discuss that. I think that doing your homework, knowing where you are, knowing who you're talking to is hugely important, and not just going in and saying, well, I know my epidemiology or my statistics, but it's the ability to contextualize it. But also, I think having a degree of courage. And I think we need to have courage and confidence. I think too often one sees at these meetings people from public health who are at the table, but not really. And I could be unkind and say that they're shuffling their papers and not saying things. But I think you do need to have the confidence to speak out. Something I've said before, that people are often say, well, I don't understand that. I mean, I was having a discussion, as I say, this week with somebody from a central bank in a European country about environmental, social, and governance indicators. And we were having I think, quite a high-level discussion. And you might say, well, what do I, as a public health professor, know about that? Well, I've actually done quite a lot of work reading it up. I wrote the evidence review for the Pan-European Commission on Health and Sustainable Development, chaired by Mario Monti, a former Italian Prime Minister and European Commissioner. We can read these things up. We can go to Wikipedia. We can read the books. We can learn them. And then we can have an engaging conversation where we will be taken seriously. But we've got to be competent to understand what we're talking about. And we've got to be confident to do that. And I don't see as much of that as I would like.
We're getting towards the end of the episode, but I'd really appreciate if it's okay to ask about personal resilience and work-life balance. That's all right. You've obviously been working hard for a while now.
A long time.
I didn't want to say. What lessons have you learned along the way?
Well, I should say I'm incredibly fortunate to have an amazing family. Got a fantastic and incredibly supportive wife and 2 daughters, and that's great. And I've also got some very good friends who are in the same area. And I think there are not that many people who do the sort of job I do, because I do travel very extensively, very long hours, going to airports at 4 a.m., getting back at 11 o'clock at night. There are other people like, I'll name Richard Horton, for example, a very good friend who has a similar sort of life. So there is that shared understanding. And I think that's important, because if you're not doing that, it is quite difficult to appreciate it. That sounds a little bit arrogant, perhaps. But I think some of us do lead very unusual, very atypical lives. And having other people who do that, who you can talk to and confide in, is actually very important. What I'm basically saying is social capital is important. Well, I would say that because both I do research on it to show that it's important, and it's important in my own personal life. But I think you do have to probably take care of yourself. I don't think I do anything like enough. I won't get into all of the things that I should do that I don't. But on the other hand, yeah, I'm incredibly encouraged, because, I'd like to think that not in the UK, but at least in other countries and internationally, the work I do does make a difference. And that's incredibly rewarding. And particularly at a European level, I'm very, very fortunate. I'm very fortunate to have a very close working relationship with Hans Kluge, the WHO Regional Director for Europe, which I think is a mutually supportive relationship. And that's what keeps me going, basically.
And just so I can agree enough on the importance of your work, your name very frequently gets brought up, and it's always in a very positive light.
Oh, that's kind. Thank you.
Just to end on the last question that we ask all of our guests, what career tip would you give to those currently training in public health?
I think one of the most important things is to listen to other people. I've talked about my friends, my colleagues that are mutually supportive. I've been incredibly fortunate to have some quite amazing trainees, PhD students and others. I think 5 or 6 of our current professors at the school are my former students. I've got a great group at the minute. I've got others that are progressing through the system. I've got others who've done work elsewhere. I have colleagues all over the world that I listen to and I learn from. I learn a great deal. So I think that is, the first thing, to listen to other people, but then to do more than that, to actually turn that learning into action and try to make a difference. And I'm not sure if that's what I would like to think I have at the end. And the point I would make is that after all of this, there are lots of ways in which one wants to change the world. But ultimately, for me, my legacy is the people who I have supported and trained and mentored, who are now doing amazing things, because anything I've achieved, well, collectively, they will do far more.
Really valuable lesson. Thank you. And a valuable conversation for me and hopefully for our listeners too. Martin, again, thank you very much for joining us. Really appreciate it.
Thank you for asking me.
Pleasure. Thank you. And to everyone listening, please get in touch on Twitter at TIFF Podcast with feedback and comments or suggestions for future guests. Martin, once again, thank you very much. Really appreciate your time.
Thank you.